So much information coming out every day. We're making it a point to give you some in-depth perspective every night. Tonight, we're talking about coronavirus treatments. Joining me now is Dr. Charles Dela Cruz. He's from the Yale School of Medicine. He specializes in respiratory infections and pulmonary issues. Dr. Dela Cruz, thank you so much for being with us tonight.
Thank you very much, Dennis.
What is the status for treatments for COVID-19?
Well, currently, the approach to treating COVID-19 patients are multi-pronged. Patient gets hospitalized, are treated by doctors, nurses, and respiratory therapists for their oxygen needs. And when they come to our ICU, we use our standard ICU treatments that we take care of these patients. There's no FDA-approved agents, and hospital treatment algorithm incorporates targets against the virus and how to modulate the immune response. And these medications are restricted to patients who are hospitalized.
Doctor, how does the ventilator actually work in treating patients?
So we have learned a lot from previous ICU trials to how to support patients with lung injury or something we call ARDS. We treat with mechanical ventilation strategies with low tidal volume, which is something that we've learned for many decades, how to treat these patients well. More recently, we're trying to do proning of positions of the patients, having the patients lying on their stomach to help the oxygen have oxygen with the ventilators. We now know patients who end up on the ventilators tend to have higher rates of mortality. And that's because the ventilator can cause damage on its own. So there's a lot of efforts in the hospital to try to prevent the patients from requiring the mechanical ventilators.
What are you and doctors learning about managing the immune response early on? And is it true that people with stronger immune systems might be more resistant to coronavirus?
Actually, I think as we learn more about COVID-19, it is clear that there's a component of excessive inflammation as the body is trying to fight the virus. More and more are being learned throughout Yale New Haven Hospital and Yale Medical School, as well as others, in terms of how to treat and curb this immune response. Sometimes as the body is trying to fight the virus, these immune response could be too toxic. And so there are people learning about some of these medications to curb these inflammation.
What's the biggest thing about COVID-19 that has surprised you?
I think what's interesting is that some aspect of the disease is sort of typical of what we take care of for ICU patients, and there are certainly newer things that are different. And we learn from our colleagues within the Yale system and also our colleagues around the country and the world. People, doctors and scientists have been working very hard in sharing their ideas and experiences. And what's surprising to me is within a short period, we've learned quite a lot about the virus and how to treat these patients. And I'm actually hopeful that in the near future, with clinical trials, we will have more to provide our patients.
Dr. Charles Dela Cruz from the Yale University School of Medicine, we thank you so much for sharing your insight with us tonight.
Thank you very much, Dennis, and happy Easter.
Same to you.